actually kind of our thing now, so I'm good with it.
Okay, good. I'm going to butcher it every time. This is from a guy named Owen, right? So Madeline is with our industrial hygienist company, and they've been working with us, reviewing different areas, developing kind of our documents. And then also we have Dr. Jill Merrick, and they're going to give a better introduction than I can of themselves. And then we have a presentation and kind of the ideas, questions and answers, anything, questions we've asked. Jill is a medical physician working with us on our practices and our how we can bring back in addressing anyone's questions related to the illness, to viruses, to the vaccine, and all that. So with that, I'm going to turn it over to Madeline and Jill and be quiet till we get to the Q&A part, probably.
Thank you, Owen. I'm going to start sharing my screen here. Okay, let me see here. Last time, remember, I messed this up and I had things blocking the screen. So I just want to make sure that everybody can see. And
yes.
Here we go. All right, good. I've had to upgrade my work from home. I finally just accepted that I'm going to be spending a lot of time working from home. So now I actually have 2 monitors and I've got a ring light, and I have these because I also have kids Zooming at the house at the same time. So I apologize if I look like I'm with the DJ right now, but it's for everyone's best interest. So Owen, thank you for the introduction. As you said, we're going to be providing some training today. We want to give you some information, and then really importantly, we want to be able to answer any questions that you might have outstanding from the training. So as you said, my name's Madeline. It is pronounced Rebelita, like a little rebel, Rebelita. I work for a company called Forensic Analytical Consulting Services. We do all sorts of things related to occupational health and safety. The other area that I work in for FACS is primarily in healthcare, writing water management plans and other conducting outbreak investigations in hospitals and things like that. When COVID hit, then I sort of transitioned that skill set into assisting schools in reopening. And that's where I met Jill, Dr. Merrick. I was able to work with her on a project reopening a K-12 school in Danville. They've been open since October, November, and then next week they're going to be coming back full density, which is really exciting. And I'm sure she'll be able to reference some of those experiences in this presentation. Jill is a medical doctor. She did her residency at Highland Hospital in Oakland. She's got 20 years of emergency medicine experience. And as I said, she didn't just work with me on this one school project. She's assisted several other Bay Area schools in opening. It's the first time I've been able to work with a community college on this type of project. So it's nice to kind of take that K through 12 mindset and look at classrooms through a little bit of a different lens, and particularly in the services that are needed to be provided to the students. Is much more substantial in your area than it would be in a K through 12 school. The presentation today, so, anytime your company has a training or creates a safety plan, anyone who's responsible for implementing the plan or has any kind of role in the plan, even just, being an employee, has to get some sort of training on the plan. And that goes for everything, and, hazardous materials, all of it. So the Cal OSHA created, finally, like 10 months into this, they finally put out a regulatory or guidance document that creates a standard for employers around COVID-19 prevention in the workplace. Within that standard is a requirement for training, and there's specific things that need to be covered. So this presentation covers your site-specific elements of that. And then Dr. Merrick is going to be kind of filling in the gaps there, talking in more detail about the medical aspect of things. So that's transmission, testing, vaccination, and current public health data. So she'll be starting off the presentation, and then I'll finish it up with, as I'm realizing now, is the way less exciting stuff about your safety plan. So I let her lead and do the cool stuff, and then when you guys are like really tired, I throw in the stuff that Kalisha wants you to do. There are a couple other pieces that are required within the training. There are HR elements that are beyond our scope. So there's a separate link to a Kalisha training video that I sent to Owen, and your HR program can determine how they want to share this information with you. So with that said, I'm going to hand it over to Dr. Merrick, and Jill, you can just let me know when you want to click through the slides, and please fill in the blanks on anything that I missed in your introduction.
That all sounds excellent. I want to thank all of you for the work that you do, because education is the way that people can really change their lives. And you are essential workers. You are making such a difference in the lives of so many people. And I remember when we were first in the hospital in the beginning of the pandemic, when you're concerned about your own health and safety, it's really hard to help others. And the nice thing in the year that's happened since then is we've learned a lot about the virus of COVID and a lot about how to make safe workplaces and to take that element of fear of transmission in the workplace, because we can reduce the risk very, very, very much compared to the beginning of the pandemic. So if you don't mind, the first slide, please, Madeline. I'm going to go into a little bit of Know Thy Enemy. Coronavirus, this new virus that has come out, is one of the family of all of coronaviruses. So there are actually more than 200 in that family that we never really cared about because they didn't cause a lot of trouble until this one came up. They're named for the crown-like spikes on their surfaces. And this is not just a pretty picture. Those spikes are actually what the vaccines target. So those are going to come up later when we talk about vaccines. There are 4 common varieties that make up about 15% of the common cold in humans. And we never knew them by name, really. Even in medical school, they didn't refer to them because it was just a cold. What makes this COVID different is that it can cause more severe disease. And especially in the older populations. If you look at Alameda County's own rates, we're looking at the rate in younger people is very, very small of significant hospitalization and death. But in the over 81 group, it's a lot higher. Now, these numbers are a little misleading in that they don't compare other rates. For example, the rate of cancer or heart attack being a cause of death instead of coronavirus is about 3 times higher than coronavirus in Alameda County. So, it's not insignificant, and it's something that makes coronavirus something that we've all taken precautions against to avoid these bad outcomes. A cold is unpleasant, but the bad outcome of hospitalization and death is what we're really, really trying to avoid. And we have good news on that now with the vaccine that we'll get into later. Can you change to the next slide, Madeline? So coronavirus is spread primarily through the respiratory tract. It's spread by breathing out particles that somebody else breathes in and breathes in enough of those particles that they become infected. When we first started with coronavirus, you can remember the craze where everyone was washing each of their, because we were that touches and items would be a source of worrisome transmission. Turns out that really number 1, 2, 3 through 10 is air that's breathed out by one person who's infected that gets breathed into another person. And so that transmission pathway is really important. And then the third part that makes it a little sneakier is that an infectious person may have no symptoms. So they can be transmitting without knowing about it. and you can't identify them by sight, right? So the whole point of workplace practices is to treat as though every person may have COVID, even though very few of them do, right? But none of them would you want to take down precautions at this time to be able to know that they don't have COVID, right? So a workplace that's a safe workplace right now is designed as though you could be in a room with someone with COVID, and that's okay. You're still not going to get it. It's not going to be transmitted within the workplace. And that's the goal. And what we've seen with the school populations is that universal masking, containing this primary spread by both masking the person who is sick and the person who is not sick, does wonders for reducing transmission. It takes what could be a higher risk situation of breathing face to face and takes it into a low risk category. Next slide, please. I wanted to explain a little bit about the testing, and that's because with testing, you can see if asymptomatic or symptomatic individuals actually are carrying the virus. People are infectious for about 3 days, although they can be infectious for more days. And the testing is how you can identify those cases. Symptomatic testing is for people who have symptoms. Now, your campus should not have people who have symptoms. We're going to have plenty of signage and the recommendation that if you have symptoms, you should stay home and test through your regular doctors to be able to find out your status. And this is one of the first safeguards, is having symptomatic people stay home and work with their regular doctors. The school is going to be also supporting response testing, which is once a case is identified, having follow-up testing if there are exposures to make sure that transmissions don't occur that are not noticed. And then asymptomatic testing is another tool that's used within the school, especially within the sporting programs. They'll have specific numbers of tests that they have to do before games and in proximity to their activities to be able to make sure they don't have spread within that higher risk setting of no masks and locker rooms and places that could be higher risk for transmission. Next slide, please. One of the questions people have about tests is there's some confusion because there were antibody tests early on, and people are wondering, does that show something about the virus? And the answer is yes, an antibody test can show that you've either been vaccinated or have had COVID in the past. It's not a useful test for saying, are you likely to infect anyone? Because it's not measuring infection currently in the body, it's measuring past exposure. The two tests that measure infection currently in the body are called viral tests, and they're the antigen tests that are quicker and a little bit less accurate, but good because they capture almost all the entire time that someone is at high risk of spreading. And then the PCR or LAMP tests that are more expensive and take a lot longer. Any of these tests you might see, and Owen is working with the med centers to be able to provide viral tests for the student population, and he will also support employee testing as needed. Next slide, please. So what we learned early in the pandemic, as we were medical providers with an unknown virus, was that it was starting to be seen as a respiratory thing. Virus breathed out, then could infect somebody else. The way that you take care of something that's through breathing is primarily by masking. If you mask the person who has virus, a lot of their viral particles stay within their mask and don't go out. If you, as a person who don't have virus, are wearing a mask as well, then you have that additional layer of protection. One of the things you can do to improve this is to add a little bit of distance, a little bit of space between those two people. So they're not in masks right next to each other, but they have some amount of distance. This used to be the magical 6-foot distance. You're going to probably hear going forward through the summer discussion of the 3-foot distance. And there's actually good science now that as long as you have good masking, the distance doesn't matter as much. So that means that you can pass people in the hallways. You can be safe with somebody in an office space that's across a desk that may not be exactly 6 feet. It could be 4 feet or something that's a little bit more flexible within that, as long as you have good masking. And then ventilation is the third component of cleaning and filtering the air, and that's Madeline's expertise and why they're looking at every workspace and every building and every classroom to be able to make sure that that portion is optimized as well. Next slide, please. I know I get a little redundant here, but the masks are really important right now, and that's because there's still some virus out there in the world. We're expecting that the coronavirus probably isn't going to go completely away. It's going to be something like a flu or a cold that's out there in the world, and masks, until that number gets really low, masks are going to be our number one protection from it. But again, they are so protective with this particular virus that choosing the right mask and having good compliance will really protect you a lot within the workplace. The KN95 masks are the highest level of 5 layers of filtration. A paper surgical mask at 3 levels is adequate, especially if it is tucked on the sides to be able to remove some of the air gapping. And then if you want to double mask with a paper and then a cloth over the top to be able to bring that in a little bit closer, that's adequate as well. All 3 are good options. Go ahead, next slide. This is a new slide for this presentation because of the discussion about the 3-foot to 6-foot distancing that you've probably seen a lot of news about. And again, in that triangle, as long as you have good masks, low risk doesn't change very much by being 1 foot away, being 3 feet away, being 9 feet away. When people have good mask wearing, you're in this low risk category of the green line, and 3 feet distance is not really very significant compared to 6-foot distance. Your risk is so incredibly low that the proximity doesn't matter as much. When you look at a higher risk exposure, like the blue line, then you can see that it makes a difference. But when they're talking about high risk exposures, they're talking about in the medical field. This was a study done in the medical field. We were the initial guinea pigs for everything COVID. This was people like putting breathing tubes into very ill patients without masks. That would be considered a high risk activity. The low risk activity would be even just being in a small exam room with a COVID patient. It doesn't matter how close you are to them if you're both well masked. Next slide. And the biggest game changer between a year ago and now is this vaccine. When they were doing the vaccine research, they were excited by the thought that vaccines might be 50% effective. And the vaccines that have come out have proven to be almost entirely effective, almost 100% in the initial studies of preventing hospitalization and death in everyone, in very old people, in young people, in everyone. So when you take the hospitalization and death power out of coronavirus, it kind of becomes one of the other coronaviruses. Vaccination is your number one level that you can control, because if you go and seek out your vaccine and use your education privilege to make sure that you're protected as soon as possible, that vaccination gives you superpowers. Not with the first shot, like you shouldn't just go out and take your mask off and hug your grandma after shot 1, but a full vaccination is the complete series, 1 shot of the Johnson & Johnson or 2 of the Pfizer or Moderna, and then 2 weeks to follow to allow your body to generate all those nice antibodies. The antibodies that their body is making are the antibodies against those spikes that we saw in that first pretty picture. So the body gets the information about how to make those spikes, makes a few spikes, and then when the spikes are generated, your body starts seeing those as an infection in a foreign body and makes its own antibodies to fight off those spikes. The antibodies work against the variants, and they work against the regular COVID that's non-variant, and they prevent all of the scary things of COVID, the hospitalizations and deaths. So they protect you amazingly well. They also protect those around you, and that's because in real-world studies, they found that at least 60 and probably more, around 80% of transmission is also reduced. So a vaccinated person can't pass it on very well in the event that they do get a mild infection. Next slide, please. What does this mean? I really mean superpowers, like going back to a year ago where you could have a friend over for a dinner party, where you could let your kids hug a grandparent. If people are vaccinated in their personal lives, they can get back to behaviors with small groups of people that are really, what we live for. Does this mean that we're going to take off all precautions if people are vaccinated in the workplace? The answer is no. And that's because we're not, the workplace is different than your personal life. In your personal life, you can choose which risks you're taking, which risks you're not taking. In the workplace, the idea is to make it as safe as possible for all at any given moment, so that you are protected, the people around you are protected, even if they're choosing not to get vaccination. If you're vaccinating yourself and if you're wearing your mask and they're wearing your mask, that's fine. That doesn't have to be part of the decision that affects your safety in the workplace. Next slide. There's a lot of information about the vaccine right now. If you want to know more, there are links that Madeline will send out as well. Contra Costa County just yesterday went to anyone over the age 16 is eligible. Alameda County is going to be there in about 2 weeks. And then they're expecting vaccine uptake in the Bay Area. The most recent study is that 70 to 80% of people who are eligible will get the vaccine here. This is much better than other parts of the world. And so we're going to be both protecting ourselves and protecting other people around us as soon as we can get those vaccinations into arms. We're at about 40% in Alameda County right now, have at least 1 dose of the vaccine. So we're definitely getting there. Next slide. People have asked about the variants because there's a lot of news coverage about this. And I think one of the headlines that's one of the scariest is that it's 50% more infectious with the UK variant that people are talking about. What this means is that they've looked through contact tracing to see what percent of someone's close contacts, and a close contact is closer than 6 feet for longer than 15 minutes. They're without a, but generally without mask, because the Bay Area is good at masking, the world is not, and these studies are done in the rest of the world. In the old variants, about 9% of people who'd had close contact with somebody could be infected. With the new variants, they're 50% more infectious, but that means only about 15% of people are infected. And why is this different? It's not something magic about the virus. The virus isn't stronger. It isn't in higher quantity. It does become infectious for a little bit longer time. So if you had 3 days of infection, 50% more infectious means that maybe you'll have enough virus output for 4.5 days instead of 3 days. But that means that all of the things that protect you against regular COVID, with your masks, with your ventilation, with your workplace protection, everything that you use to protect yourself against regular COVID works against the variants. And the vaccines do too. And all 3 of the vaccines available in the US prevent almost all hospitalizations and deaths. I think in the more than 100,000 patients, they had zero deaths and 1 hospitalization, as opposed to hundreds in the group that didn't have vaccine. So it makes a huge difference to protect anybody when they get their vaccines. Great. Next slide. Where are we going as a county? The answer is down. And as Owen said, we're in orange. Now we were in purple and red before. Right now, Alameda County is 1/10 of the cases on a daily basis that New York is still having today. The Bay Area did a good job of not getting too infected, even in the surge compared to other places, and the numbers are continuing to go down. Next slide, please. There may be a small 4th bump here that comes with people relaxing behaviors and getting together with more Easter gatherings, spring parties that are inside. Those might give us bumps similar to the Thanksgiving bump if people aren't careful. But the numbers are projected to continue to, even if there is a small bump, with the vaccinations to just go down and down and down. The California tier system has orange and then yellow, and they're going to have to put out, they've already announced, they're going to have to put out a green level because they expect to get to green, which is just so few cases that the chance of anyone in a school setting actually having the virus is going to be vanishingly small. And that's especially helped with all of the protection that we're getting from more and more vaccinated population. If you're looking at school, return to school later after summer, we're expecting numbers to be significantly lower than even they are today. So that's the virus, and that's a lot of things that we, working with coronavirus patients, learned early in terms of the masking, the protection, that within our workplace, the people who ended up getting COVID in the hospital usually didn't get it in the workplace. They got it at home when they had gone to a party with their girlfriends. They had got it, maybe there were a few outbreaks that happened in the break room when people took off their masks, stopped using precautions inside, and behaved like coronavirus didn't exist. Now, they could actually probably do that today with the vaccination, but the recommendation is still to treat indoor spaces like spaces of transmission and make sure that you're protected with your good mask wearing indoors. With good mask wearing indoors, there are virtually 0 transmissions. And the Marin schools have been in session for 4 or 5 months. They had 0 student to teacher transmissions just because they had good mask wearing. They had a few student to student transmissions when the students had gotten too close, but 0 teacher to student, student to teacher transmissions. They had a couple transmissions in the faculty rooms where people were doing Zoom calls right next to each other without using masks, and this is again in the era before vaccines. But by using the actual precautions, they work and they protect. There's a question about how long do the vaccinations remain effective and do we need booster shots? The answer is right now, we're 9 months out from people having their first study protection from the vaccination, and people are still protected. The most recent virology research is showing that we will probably need to get a booster in a year or two following the first set of vaccinations. And that will be adapted to make up for variants, to be able to target those a little bit more closely, and also just to boost immunity. Whereas the flu shot is, a once a year vaccination. It's possible that the COVID vaccination could be every year or two like that too, just to boost immunity. But the protection will last they're projecting more than a year or more than two. And some of the protection, they're saying, will last even as long as up to 10 years in some of the different types of antibodies. Not at the same level of protection, but it's not a matter of weeks that you're protected. It's definitely a matter of years. Any other questions?
I didn't see anything in the chat, but I have had a question come up about getting tested after vaccination. So if you get a COVID test after you've been vaccinated, will you test positive?
So that's where we go back to those different types. If you get a antibody test, that's a blood test that looks to see if you've generated antibodies, that will come back positive. And that's because that's exactly what the vaccine's designed to do. It's designed to have your body produce antibodies. So as soon as it sees a COVID virus particle, it attacks it and neutralizes it immediately. So that will be positive. But the actual viral testing, the antigen or PCR testing, is only detects the presence of the virus. So it could be positive, but only if you actually have COVID virus within your body or a false lab test.
Thank you. This is like a totally different experience than the last one. We had so many questions last time, but I think we added more slides too. So covered a lot of, and as predicted, the county's in a different place now than it was last time we did the training.
I think that, again, from the medical perspective, it was hard to not know how safe the spaces were that we were walking into those first couple months. As we became more confident that we knew how the virus behaved, that we knew how it was transmitted, we were more confident about how we could protect ourselves and our coworkers. We are also confident about things that didn't matter as much. When you have a good mask that's blocking airflow, that's blocking virus transmission for both yourself and the other person, like having plexiglass dividers isn't very much helpful. In fact, it can break down some of the filtration. So some of the things that we were doing earlier by putting plastic walls around things were actually not very helpful at all. And we can now really reduce it to the effective things that are proven to work, and be comfortable with making very, very low risk of transmission within a controlled workspace. There's a question about ventilation management, and that's definitely Madeline's specialty, but usually when a building is built without windows that open, it's because they have upgraded HVAC systems that account for airflow. And Madeline will, I think, go into that in depth later in her presentation about the specific facilities. Are there any other questions about protection from vaccination? Are there any concerns that you have about not having vaccination, or talking about it with your friends or family? we have a lot of different, ideas out there about vaccination. And, I think that as soon as my husband becomes eligible, which was yesterday, as soon as I can nab an appointment for him, I'm going to get him in. As soon as my kids are old enough to qualify, I'm going to protect everyone that I can. And if you can help the community, if they're having concerns, reach out to their physicians, reach out to the public health department, get their questions answered. You can be movers and shakers to really protect everybody in your world by sharing this fabulous news that the vaccines are safe and effective. There's a question of how long is it safe if both people are masked in a 10 by 10 foot door with room with the door closed. So, like, answering from the hospital perspective, a lot of our exam rooms are 10 by 10 or smaller, and we have COVID positive patients in them. They are in the hospital, they are in the emergency room, not for counseling help, but because they're actively sick with the peak of their COVID infectiousness. And within the hospital setting, we found that you can be in that room a really long time. You can even be in that room probably all day, as long as there's, again, Madeline will go through your building's airflow. But the masks are really, really protective with that. The question is, does the Americans with Disability Act allow us to ask if people have been vaccinated? That is more of a legal question. And in general, if people are not vaccinating, sometimes they have a medical reason they don't want to share. Sometimes they have a personal reason they don't want to share. It is probably not something that you're going to know. You're not going to know the status of your students. I can say that Owen is reaching out to make sure that that people have access to the vaccine who are working. People have knowledge about how well it can protect them and their families and their loved ones, and that he's going to also continue that educational message to the community. Your students are probably going to be inundated with get your vaccine. At that point, the public health department is going to be practically going door to door to make sure that they can get as heavy saturation of the vaccine to protect all populations as we can. So I think there's going to be a lot of support, especially as more and more appointments become available with increasing availability of vaccine. That we're already at 40% first shots in arms is fabulous. That means before next August, we're going to be anyone who can have who wants a vaccination can probably decide that day to go and get it, and not wait a month or 2 months or 3 months to be able to find those appointments.
I have a question and thank you for explaining all this. Really appreciative of you coming into the space. One question I have in terms of the testing, and not the antibody test, but again, the test if you have COVID. So if you are vaccinated and you're going to come into contact with people who are not vaccinated, it sounds like, I just want to make sure I'm understanding you correctly, there's a very small percentage that you could be carrying it. So would it, in a small setting, you're coming to house setting, no masks, you don't know about the ventilation. Would you suggest that the folks who've been vaccinated go ahead and do testing when they come into those situations?
Not necessarily. No, they need to do symptom screening. After you've been fully vaccinated, the only medical indication to test is if you have cold symptoms. If you have cold symptoms, then you can get a test. But even within the hospital, where we're still seeing people with COVID every day, right? Because that's
right.
Our job. Is a box with the patient. We're not, or we are with our families. We're not testing. because again, through that mask, you need to have a significant amount of virus to be able to catch the virus. That's why only 10 to 15% of people get it. Most people won't even get it even without a mask with an exposure to COVID. It's about 10 to 20 times harder to catch than something like measles. So you need a lot of that virus. And then when you have the vaccine, your antibodies start in the layer of mucus sliminess of your nose. They are sitting there waiting to see if there's a tiny virus particle and motivate and attack it immediately. So the chance that you're going to get it as a vaccinated person to the volume that you're going to spew it to somebody else is very, very small.
Okay, thank you. I'm taking notes. And so one last question on that note, just to make sure, if someone's half vaccinated, you've already done the first and you're waiting for the second, would that be a time in which, if you're coming in contact with non-vaccinated people, you would still want to do the test?
So you get about 80% effectiveness out of your first vaccine, which is really good. But what I would do, and what I have my husband do, who isn't vaccinated yet, is just use the precautions we've been using for the last year. We went to see his his parents last week, and they're fully vaccinated. I'm vaccinated as a healthcare provider. So we can gather as vaccinated people, and we just put him and the kids on the other side of the dinner table, 5 feet away from the grandparents, and kept that space, and then they wore masks if they were at any time closer than 6 feet. So as you kind of go through this last 6 weeks of waiting for your Freedom Pass, just use the same precautions you used in the last year, and you're going to be fine.
Thanks.
I think that it looks like it's time for Madeline to get through to the building, the specifics of the building 700, and her plan for keeping that space a low risk environment.
Thank you, Jill. And certainly, as we're moving through this, you may think of something that you wanted to ask related to Jill's presentation. There's going to be time for us to continue this discussion. I think Owen might have been pulled away just momentarily, but as far as I saw, there was a question in there about the frequency of filter changes within the HVAC unit in building 700. Oh, you're back. So he can get into some more detail about that as well. And I think that it sounds like that concerns about ventilation are at the forefront of your mind. And so I think it might be better to kind of just have that conversation now and get it out of the way so that you're able to kind of focus on some of the new information that you're getting.
Yeah, sure. So building 700 is not unique among our newly constructed buildings on either campus, right? One unique part is that the lobby area is fed from what are called outside air louvers, and the heat source isn't through the ductwork and system, it's through radiant heating and cooling in the floor of the lobby. So slightly different, but all the spaces where everyone works, including the second floor, which is open to the atrium area, that is fed from ductwork. That ductwork has supply and return ducts. The return ducts go back, bring the air. Some air gets exhausted, some air gets recycled back into the building after it's gone through filters. Those filters on our current schedule are changed twice a year, so every 6 months. They're also changed after significant wildfire wood smoke events. So if we have an event where it's a prolonged period of time where we have wildfire wood smoke, we will go in and change those filters immediately afterwards and then fall back to our regular schedule every 6 months. Now, we did, once we lockdown. We didn't go in and change the filters. Even though that we've had very limited occupancy in the building, we've maintained that every 6-month schedule for changing of filters. But we also inspect the filters every month, and if any filter is found to be dirty or, not, looks like it needs to be cleaned, we'll change them out in advance. So the only area, and remember, for wildfire wood smoke, we want to limit the outside air that comes in, but for COVID, we want to increase the amount of outside air that comes in. So even your lobby area, which brings in fresh outside air from 20 feet in the air or 20 feet above the ground level into your space, that's a good ventilation strategy for that space. Your doors that open into the lobby, they're automatic doors, they open and close. And on busy days, they stay and they're held open quite often because there's people coming and going in and out of your building all day long. So those are all good strategies for keeping the airflow. But know that, as Jill mentioned, the mask wearing, and we're going to continue with mandatory masking in the workplace, right, as we go forward. But the mask wearing is our best strategy at the moment. And then our filtration has been upgraded. All of the areas on campus are at least a MERV 8 filter. I believe the 700 building is the MERV 13 filter, which is a higher level of filtration, and is actually the ASHRAE recommended filtration is MERV 8 as the minimum and MERV 13 where available to be done. So, hope that answered your question.
And one other note just on the filters. The virus is a living particle, and it dies on surfaces. So it's not like it's going to be building up in your filter over weeks to months. Every virus particle that lands there is going to be dead within several days. So it's not going to be, a danger of building up to a critical mass and breaking through.
Thank you, Jill. And I think another point there and I don't want to get too deep into ventilation aerodynamics. Actually, I would love to, but I think it would probably put everyone to sleep. But, when we talk about airborne transmission, Jill was talking about respiratory droplets and aerosols. And the droplets are big things that kind of fall out of suspension very quickly in the air. And the aerosols are little tiny things. We actually call them droplet nuclei. And everybody knows this term now. It was like a secret term with industrial hygienists before, but now everybody's hip to it. But the droplet nuclei are very small, and while they can carry a virus, because virus is very small, as Jill was saying, the viral load needed to be infected and to be infectious to others is higher than that which you're going to find in a little aerosol. You would have to come in contact with a whole lot of those aerosols, which would be in a small space, unmasked, right close to each other, and not have and be there for a long period of time. She talked a little bit about measles. Measles was so infectious because it only took a little bit of that virus in one of those droplet nuclei, and I could be, expelling those aerosols in a room, and then you walk through it later, and you're exposed to it. So thankfully, we're not at that point with COVID, that this is a different experience. But I want to keep that in mind when we're framing this conversation about ventilation. I saw a question about which is better, face shield or face mask. So a face shield is not a replacement for a face mask. It is not a substitute for a face mask. They're two different things. A face shield will provide additional protection for your eyes, but it does not provide the same level of protection that a face mask would. And now Jill has had a lot of experience with going through these iterations of face masks and respirators and face shields in the hospital. And, our current guidance from the state is that, and in your safety plan, is that if you wanted to supplement your face mask with a face shield, that's fine, but you can't use it as a replacement. Better protection, to my mind, and what the science supports is coming from a face mask rather than a face shield, because that face shield is open at the sides. remember Jill was talking about the tighter it is on your face, the better. So the more snug fitting that face covering is, that's why people are like double layering, not just because they want to add some other level of filtration, but it's also going to make it fit a little tighter. Different masks, efficacy, like polyester activewear material versus cotton versus. So Jill talked a little bit about this. I'm going to hand it over to her, and let me know if you want me to go back to any of your slides, Jill.
I can share a document with Owen as well that kind of goes over the current recommendations are for good filtration are either a KN95 level mask with nothing over the top. That's five. You can see it there. It's 5 layers on the left. 5 layers of different papers that both have electrostatic charge that sucks particles into them and filtration. That one, we're not recommending that it be worn with an over mask because it already has a tight kind of contour around the face. The second mask is the paper surgical mask. It's a 3-layer mask. And actually, it can be just fine alone as long as there's a technique in the CDC called the tie and tuck, where you just kind of bring those pouching blanks on the side and you bring it down. And I'll share that with Owen as well. So that alone is fine as long as you take away those big air gaps. And then the third option that's good right now is if you don't want to deal with tinkering and making a paper mask perfect, then wear a paper surgical mask underneath and put whatever you want over the top, cotton, polyester, whatever fits and is comfortable. Because what that does is it takes that filtration layer and just makes it to take away the air gap. We'll send you a link for that.
Thank you, Jill. And, you know, at the beginning of all of this, the respiratory protection pieces, the face coverings, things were difficult to source. And the picture that you see here, we're saying KN95, but this picture here is actually an N95. The 95 just means it filters out 95% of particulates of a certain size. The N95 is the one that's made in the United States, and it's approved by a company called NIOSH, which and looks at all these different safety equipment. And the KN95 is a very similar design, the same layers of filtration, but it's manufactured in China. And those are a little different. You'll see the straps here go behind this gentleman's head. The KN95 has the ear loops. And the N95 here that you see, this is what we in the world of industrial hygiene call it's respiratory protection. This is what is given to workers, not just in healthcare, but in other professions to protect them from exposure to certain size particulates. And for it to have, you know, certified 95% guaranteed, it has to be properly fit. And requires that you get on a medical surveillance program. And so we don't recommend wearing a respirator for one, our healthcare workers and our other workers that need them to keep them safe at their jobs because of their particulate exposure or other factors, need to have access to those, and there's a limited supply. The KN95, this is my favorite. I got this off Amazon, has a nice snug fit. It goes behind my ears, so it's not jacking up my hair when I'm trying to work. And they're disposable, and they're very easy to source these days. The FDA has looked at the KN95s and up until about a week ago had authorized them for emergency use in some medical situations. And they've since repealed that order, not because they're not as effective, but because there's less of an issue with supply of the N95s now. So any kind of like snug fitting face covering that's going to give you additional layers of protection is helpful. A single layer like cloth or bandana is obviously not going to be, that's loose fitting, is not going to be the same as a KN95, right? There was a question here, Owen, about the type of mask that Chabot is ordering for their faculty and staff. Before you answer that, I can't help but I found these. This is hysterical. I think you guys got these at like the very beginning, and before any of us really knew it all. And I was just cracking it up because I think, you know, somebody was like, no, I'll make them and bring them in, you know, but this is definitely like not the one you want.
Yeah, so those were March 20th of last year we ordered those. Not knowing exactly, you know, knowing that we had to have a face covering, and the recommendation on it at the time was make one out of your T-shirt, right, and walk around with a crop top on. So, but the answer is we have some supply of KN95 masks, kind of limited quantities, normally being used right now in our allied health fields. Or distributed through into our allied health classes, but we do have some available. We have the 3-layer surgical face covering types, and those we have a significant quantity of, and you'll see those distributed around campus. And if you need more, please let us know. We're working on a way to get them through our work order system to be included. So if anyone needs some for their area, just submit a work order through M&O, and they'll bring over a couple of boxes for you. We received approximately 1 million, just over 1 million of those surgical face covering masks from California Office of Emergency Services, and we still have a significant quantity of those left. And those are, quote unquote, disposable, right? So you can use them, grab another one, and use it. And then we also have a 2-layer white cloth face covering, in addition to the one that you've seen. That we have approximately 60,000 of those cloth ones left. So if you're looking for a combination method, and I have seen individuals who've taken, and the cloth face covering is all white. I have seen people take a marker or a Sharpie to their cloth face covering and draw images on it, or symbols on it, or slogans on it, and use those as well. But all of those are available. We can make them available as more people come back into the workplace, and we will bring them out, put them out, and make sure we're restocking those as necessary. But so hopefully that answered that question. And I saw one a question regarding the 3 to 6 feet apart and the use of plexiglass in the workspace. So, Jill, maybe you can, you touched a bit on it earlier.
I did, although, Madeline, I think that you were mentioning that there's 6-foot spacing for the most part within the office setups themselves. So we probably don't have to go too deep into the weeds on this. It's more, can you put more kids, more students, even adult students, within a classroom setting than is your everyday workspace going to be only at 3 feet for the whole day? Is that correct?
Yeah, I think
a little, yeah. Or, sorry, go ahead, Owen.
Yeah, I think from our counselor's perspective, our audience for today, right? They've got the 10 by 10 office. They're going to be in their office counseling another student, or potentially, a student and, other family member who might be with them for translation or whatever reason, just for emotional support. So there might be 2 people in that 10 by 10 office, and that space across the desk might not be 6 feet. It might be 3 feet.
Understood. So what I would recommend for that, because again, that's sounding an awful lot to me like an examination room that we're using in the medical field, is not to have additional dividers, because that actually, having the additional plexiglass divider makes it so that you have to speak more loudly and more clearly, even behind your mask, to be able to get your message across. And like screaming or having to project additionally, first of all, it tires your voice out through a day, but it actually creates more aerosols on both sides of that. And there's nothing that plexiglass is going to catch that the mask doesn't catch first. You know, if somebody spits while they talk, that spit isn't coming through that mask and getting stuck on that plexiglass wall before it goes across another 3 feet of table to advance the other person. You know, if the person didn't have a mask on and was spitting madly, I'd want that plexiglass divider. But anything that is going to be caught by plexiglass is caught by the mask that person is wearing before it even makes it across the table. And instead, the plexiglass in both blocks airflow through the room and can obstruct some of the ventilation of good circulation, and makes both a physical barrier that detracts from your interaction with the person in a way we're already a little bit isolated, and you want to make connections with your students that are certainly safe, but having them shout through a plastic screen isn't going to actually create safety. It just creates barrier.
Yeah, and that's a really good point. And so when we're thinking about, because I'm seeing more questions about like, well, should I have it in my workspace? When we're thinking about where they're beneficial is areas. So think about where you've seen them, right? And trust me, I'm watching everywhere I go. And there's some places where I see a plexi barrier and I'm just laughing because it's in an area and that provides a service, or there's a task where the first thing people do is they get close because they can't hear the person, and then they move around the barrier. So you've already lost distance, and then they're talking louder because it's a loud environment, like a department store or an information kiosk in a busy lobby. So when we're thinking about where plexi is going to be beneficial, we need to take into account a number of factors, but primarily it's like, are you going to be having a lot of interactions with lots of public throughout the day where you're going to be standing in the same spot and they're standing in the same spot, and maybe it's a quiet area so you're not going to have to yell, or maybe it's a really loud area and you expect you're going to have to get closer. But if that plexi barrier, they can only be so high before they fall over, right, if they're not connected to the ceiling. If it's not at an appropriate height, you know, if it's a big open environment, so for example, your counseling offices, those are like 8 to 10 foot ceilings. They're pretty high ceilings. And each one of those offices, because it's a modern building, has both a supply and a return for the most part. So you're getting lots of airflow in there, lots of circulation. And that plexi barrier is only covering so much, right? So those little droplet nuclei, which are so light and they hang in suspension for a long time, you know, like little dandelion seeds, those are easily going to go over the barrier. So if you are in a space where you cannot maintain distancing and you know that there's going to be another human being within closer than 6 feet for your entire workday, or you're going to be having lots and lots of interactions, that's a place where we can look at it and think about maybe plexi. But for all the reasons that Jill talked about, for one, with just masking and distancing and places where you can add a little bit of additional dilution from ventilation, either increasing outside air intake or opening a door or window, those are places where you're already very well protected. But we can, you know, look at some of those areas and make those determinations. If you feel really, really strongly that that's what you need, that's another thing too, right? So I usually start the presentation with this caveat, so I'll just say it now, but, you know, we can, you know, talk to you all day long about the different controls and all the different things we're doing in your space. But at the end of the day, if you don't feel safe, you are still a hazard in that workplace. If you are stressed and anxious, that is a workplace hazard. And it's a very real, it's as real and tangible a hazard as, you know, a tripping hazard, a cord on the floor, right? And maybe more so, because when we're stressed and anxious, we can sometimes be careless, we're distracted. And it's a really unpleasant experience to be at school or to be at work. And, you know, you have a really critical role in the success of the students at the school. And you need to be able to be there and feel like you're doing your best job. So there's the science of it, and then I guess there's like the perception of it with the plexi. Do you feel safer, right? And that's definitely part of the conversation as well. So I think, Owen, if you're able to kind of watch the chat for me, I want to just, and to be mindful of everyone's time. I think some of the questions may get answered in the next few slides. So I want to be able to do this and frame it in a more structured way. But definitely, if you have a question, write it down or put it in the chat, and we'll make sure we'll get to all of them. I think that might be an unmute.
Yeah. I think the question, Catherine Field asked a question about in the computer assessment center and having plexiglass dividers there. And I think you're going to answer that question in a minute, but the first question is, can we create more distance in that assessment center without the need for a divider? That'll be our first review when we go to the assessment center. Is can we create the distance? And if we can create the distance, then unless it's creating that I feel better approach, then maybe we order a lesser quantity of the plexiglass under that case. But
yeah, and the other thing to think about with plexi too is like now it's another surface. It's like another thing that is just going to have to be managed in the space. Over time, they do get, I'm sure you've seen it at the grocery store, they get like kind of scritched up. They have to be cleaned in a special way with a microfiber cloth, and all of the disinfectants that are approved for doing like a cleanup if there's been an exposure in a room, like for example in a hospital situation, all of those are really kind of damaging to that plexi material. So we can definitely keep talking about it. I did see the question about, the risk to students being exposed in situations, and we'll definitely cover that. So this piece here, this is what you need to know about your safety plan. And I'm not going to go into all the details. Poor Owen has suffered through hundreds and hundreds of pages of documents. I will say when we first started developing these safety plans, as hygienists, this is what we do. We write health and safety plans to ensure that organizations, facilities that our clients are in compliance and they're keeping their workers safe. We were just trying to do this based on our knowledge as industrial hygienists. And so now, thankfully, we have a much more direct framework with the Cal OSHA guidance. And then we've supplemented with adding in some additional things that are best practices in, state-of-the-art industry practices. And of course, we have the benefit of medical consulting as well. So your plan essentially comes down into these three parts. It talks about how it's organized and implemented, and that's your COVID safety team. That's your Captain America here, Owen. Captain COVID safety, Owen, is your lead on this. And then it talks about the prevention piece, which goes into how all of the workplace hazards have been assessed and managed, and then discussing the response. How do we respond if there are cases? And then Cal OSHA also talks about how to respond in the case of an outbreak. It does talk a lot about what your responsibilities are as an employer. One of those things Owen talked about is you have to provide face coverings in the spaces. You need to provide hand sanitizer. You need to provide, response testing free of charge. So there's things that are within that document that are specific to employers, but it really applies to everyone who's coming onto your facility. Okay, so I'm not going to go into all the details of your COVID safety teams. The prevention piece, we've talked a little bit about this, but essentially how this approach worked is we came out, we assessed the hazards, looking at potential air. And at the beginning of this, we were still focusing on surface transmission, which now we know, thankfully, that's not so much of an issue. And then from there, based on looking at your different spaces, developing some area and task-specific work practices, providing training, which is what you see here. And so all those COVID safety teams, the administrative staff, they've received quite a bit of training already. And then verification of implementation. And this is something we haven't even had the opportunity to do yet, really, because you haven't come back yet. But you would expect that, part of that verification piece is, reporting any deficiencies in your work environment, any issues that you're seeing or protocols that aren't being followed, but also, communicating with the team, like the way that this is designed doesn't make sense. Like we put plexi over in these places, but it's actually not helping. So continuing to provide that response feedback, but then also periodic inspections and making corrections and improvements. The response piece, like I said, that's the last big piece of the plan. And this is similar to how we approach the initial evaluation and incident assessment. So there is a detailed case response form in the safety plan, which sort of mirrors some of the CDC and Cal OSHA guidance. We've consolidated it all, and then, as I said, added in some industry guidance as well. Assessing any potential people who may have been exposed, any areas or surfaces that might have been impacted. As we said, this is less of a concern these days, but that is still in the guidance, that if there is an area that has been impacted by a case within a certain number of days, that they do recommend performing some enhanced cleaning and disinfection of the area and surfaces. Notification and communication, really important, not just to notify local health authorities, but a plan for how anyone who was potentially exposed would be notified, and then notification to the community as a whole. Cleaning and disinfection, so recommendations on specific products. Cleaning is just, removing dirt off of a surface. Disinfection is when you're using a specific product to kill a specific organism or set of organisms. And the EPA has a list of ones that products that are approved for SARS-CoV-2, the virus that causes COVID-19. And so we've gone through and looked at evaluated your cleaning and disinfection products and made sure that you have appropriate ones. And then verification and documentation of this entire process. Last couple things that are also in the plan, obviously addressing ventilation and filtration. Water quality, so for buildings that have been shut down or had very low use, some guidance on flushing and temperature control, and making sure that there's no issues with the water as the building has sat unused for a period of time. And then some forms for managing procurement and supplies, critical supplies that are needed for the plan. That's pretty much it for the written plan part. For your area and specific things, we focused on developing practices around these 5 principles, and then I would add to ventilation has become a primary focus over the last several months. So within each of the, I've been downing that Fresca. If you've been watching me, it's got some bubbles in it. Within each of your spaces, we looked at how we would manage distancing, personal hygiene, protective equipment, environmental disinfection if it needed to take place, and medical screening. So as you've gone through your Building 700 documents, you probably recognize our little icons here. But the important piece of this is understanding that each one of these control elements does not exist in a bubble, right? They all are part of an overall plan for managing exposure to certain hazards. And the way that we look at this in the world of industrial hygiene is we call it layering of controls, or the Swiss cheese method. So each one of these controls fits into sort of a different bucket, a different category. Either it's focused on elimination, excluding COVID from the workplace, engineering the space, administrative controls, and then the personal protection piece. But each one of those things on its own isn't 100% protective, right? So if you're looking at the elimination piece here, the symptom screening, quarantine and isolation protocols, testing, vaccination, those aren't 100%, right? So someone may be asymptomatic. Someone may not have done their symptom screening and said they did. Someone may, you may have a fair amount of people that choose or not to get vaccinated or unable to get vaccinated right away in the workplace. And you also don't know who's been vaccinated and who hasn't. So there's holes in that Swiss cheese slice, right? But then you're adding in another layer, which is the ventilation, the room layouts, the area markers, distancing, hand washing stations, put in that other layer of administrative controls. So having some staggered schedules so there's less people in spaces at certain times. And then, of course, as we've been hammering on this, is the universal masking, that protective piece. So as you can see, the more you layer these, the more those holes get covered. But the only way that it works is if they're bundled together and consistently followed. And I gave this presentation to some 7th graders, and I made the analogy that the Swiss cheese slices were like a Krabby Patty, and it went over like gangbusters. So I left SpongeBob in here, hopefully to help you guys remember this piece of the information. But if we go back to what Jill was talking about, the risk mitigation triangle, we're focusing on these 3 pieces, masking, ventilation, and distancing, because we know that this is an airborne disease. It's transmitted through the air. That what she was talking about when she presented this to you was that if you are not able to close the holes in the cheese or add more cheese in one area, for example, say you're not able to do your work outdoors where there's just amazing, perfect ventilation, or maybe it's a situation where you're not able to maintain distancing for that whole period of time. That's less important because you have a very well-controlled aspect in the face covering. So that face covering there, you see now SpongeBob has his mask on. I'm really kind of proud of that graphic, you guys. But that right there helps in a very substantial way. So when you're thinking about your spaces and you're asking questions about ventilation and distancing, understand that those, even though there's holes in that cheese, right? You may not be able to have HEPA filters in your air handlers and open windows all the time because it's, there's wildfire smoke or we have to shut it down. That doesn't take away from the level of protection you have when wearing a mask. And vaccination is how you're going to manage that host susceptibility piece. So that right there, it's not even like Swiss cheese. It's really more like a Kraft single. Thank you. I know you're all muted. You're probably applauding right now with my Kraft single animation. So what is it going to look like? This is kind of an overview. We've talked about it a bit, okay? Face coverings required at all times, including restrooms. So restrooms are a place where we sort of like reflexively take a mask break sometimes. So we take our mask down to pick something out of our teeth or, I like to put on lipstick, pointless of wearing a mask, but I don't know, it's a thing. Restrooms are places where there's not always great ventilation. Not every restroom has an exhaust fan, and even then, not everyone's always using it. Lots of people are using the space. Someone else may have been in there unmasked, and it's where we tend to kind of like drop our guard a little bit. So just remember that the face coverings are required in those restrooms. Places where you can remove and take a mask break. If you are alone in your individually assigned office, not a cubicle, but your enclosed office space, right, where you can close the door and you're by yourself, you can take your mask off. If you are outdoors and 6 feet apart, you can take your mask off. One caveat to this, which I didn't put on the slide, was people who are within the same household group. They may be sitting next to each other outdoors eating unmasked. That's okay. They're from the same household group. We have talked about what some of the exemptions are for people who've been vaccinated and what your level of protection is as a vaccinated person. That doesn't supersede any of the face covering mandates for the state, and it doesn't supersede any of the face covering requirements in your workplace for now. Enhanced filtration where possible, so where upgrades could be made to the level of filtration in the mechanical ventilation, those have been made. Mechanical ventilation has been adjusted to allow as much outside air intake as possible. And where you can open windows and doors, the CalOSHA guidance states that those should be open unless it's less than 60 degrees outside or more than 90 degrees. The AQI is over 100, so that's what Owen was talking about, those wildfire smoke events, the air quality index. Or if there are additional hazards, such as rain, wind, snow, obviously coming in the windows, you want to be able to close them. Symptom screening for people who, no one should be coming on campus if they're symptomatic or if they have been exposed to someone who is symptomatic or COVID positive. That's part of the plan. And then accommodations for anyone who self-identifies as at risk. 6 foot distancing is best, but no less than 4 feet in classrooms right now. There's an asterisk there. So the 4 feet, that comes from the current K through 12 guidance for the county, but the state has adopted the CDC guidance for K through 12 schools of 3 foot distancing in classrooms. And as Jill was saying, we expect there will probably be some changes in the guidance moving forward, not just for K through 12, but for workplaces and for institutes of higher education as well. Physical barriers, we talked about that. You've already done some of this in some of your spaces, but putting distance marking down, where people may potentially be lining up to go to a kiosk window or something, using stanchions to manage some of the distancing. So in those places where you have installed plexi barriers, where you're having lots of interactions throughout the day, to keep people from getting extra close, putting those stanchions up there. Hand sanitizer, for when it comes to hand hygiene, CDC, WHO, everyone recommends hand washing for 20 seconds with soap and water is the best. In the absence of that, hand sanitizer, or as we call it, hand rub, is good. And then daily cleaning and disinfection of high-touch surfaces is being managed by your environmental services group. So we can get into some, I'm sure the chat's blowing up, but just a reminder, the plan elements are a framework, right? All plans are in a draft state always. That's why that first slide, it said draft on the little plan graphic. They provide a basic structure for you to help develop practices, but there are some areas where you may need to develop things beyond what we've already created for your spaces. And elements are subject to change. We know that this is something that's been constantly changing, and so the template language in the plan may become outdated, and it's going to require some periodic review. As an individual, I highly encourage you, with all your free time, right, to continue to educate yourself, to look at the guidance yourself. That CDC website is really great. They have a frequently asked questions page, and you just put in anything, and they will give you all the information they have about it as it relates to COVID. Your industry experts, industrial hygienists, we also have a blog on our website, which we have lots of different blog posts about COVID-19 in the workplace. And our most recent one, if you're having trouble sleeping tonight, you can go through trends in multifamily property maintenance during pandemic operations. But there's other stuff in there. And of course, you can always ask questions. I'm always happy to answer them. Owen has been an incredible resource. He's really, one of our mission statements at FACS is we create experts within our group and also with our clients. And Owen has really become an expert over time. And so he's certainly a great resource for this. And I do want to say, too, I think I've said this to a couple of the groups before, but I want to echo what Jill said. I went to community college. I know Jill also went to community college. I think we were both Vikings. Did you go to DVC?
I was at San Francisco City College for a while.
Oh, okay. Oh, that's where my husband went. He played football there. So, before I did this, I was in the military. When I got back from my deployments, you are part of a group that provides services and veterans benefits. It was so important for me to be able to get to school and get the help that I needed. And community college, thank you. Community college really gave me the confidence to pursue science, which is, I did it because I love it, not because I'm good at it or it was easy for me. But it created this bedrock of education and understanding for me and for so many of my colleagues. So what you do is incredibly important. And not only that, like the opportunities that you create for communities that are traditionally underserved and recognized and underrepresented in the higher education community, bringing them into the dialogue and making them part of this experience is just so important for not just my industry, but the medical field, for everyone. And so I do want to thank you and recognize everyone that plays a role in that. You're very critical. And I know that it can be scary to come back to work during a pandemic. For those of us who've been working the whole time, it's easy for us to be like, yeah, whatever, it's no big deal. But, there's a risk tolerance spectrum, right? And then one end is like firefighters who are crazy and they just run into burning buildings, right? And then there's people who are like people I know who are fully vaccinated, they have no underlying conditions, and they're still afraid to leave the house. There's validity along that entire spectrum. And our role here, and particularly having Jill on board has been very helpful, is to help you to navigate your way from wherever you're at on that spectrum to be able to come back to work and to continue providing these services. So that being said, I'm happy to turn this over to Owen and we can start to answer some of these more site-specific questions. And I'm going to stop sharing my screen here too.
Thank you, Madeline. So the chat has a few more questions in it. I'll try to answer a few of them. Heather asked a question about concerns in the workplace, creating social distancing. So we do have floor markers that are out there. You'll note if you're back on campus, you'll notice some entrances have been labeled as entrance only or exit only. So we've tried to create a traffic flow in some conditions. And floor markings like you've seen in grocery stores and everywhere else to have people space out when they're in line. We also have additional stanchions to create that separation between people that Madeline talked about. We do, and also asked the question about masking. We do have masks, the cloth masks that we can provide to students. We got 1 million masks, right? So our intent is anybody who shows up and doesn't have a mask, we'll provide them a mask and ask them to wear the mask. I think now in our society, it's perfectly okay to ask someone to wear a mask, to hand them a mask, because I might have gotten out of the car and forgot my mask, and I got to the entrance to the building and then realized if I can look around quickly and find one and grab one, I'll feel, I think, and everyone else is wearing one. We're modeling good behavior ourselves, and therefore I think we'll see more good behavior out of our students. I can tell you from our classes that have been on campus, the mask wearing is not an issue for the students who've been on campus. They understand it. They're used to it. They were wearing their mask and have been wearing their mask. And we haven't had any concerns raised by a student who has refused to wear a mask. We might, the goal here is to encourage, not to criminalize or penalize someone who's not wearing a mask, but to encourage them to wear a mask, knowing that in counseling, you're not going to be dealing only with students or only with staff. You're going to be dealing with someone who may be in the enrollment process and they aren't yet in our system as a student, but you're helping get them there. And so normally I would say, okay, if it's a public member, campus safety is the one who's agreed to kind of try to address a public member who is there. If it's a student services offices agreed to try to address the student. If it's staff, then obviously it's either their supervisor or the dean or, up through the college hierarchy for who would address those individuals. But it's kind of all of us together to meet that our new social contract of wearing a mask. We're updating, increasing, adding more signs to campus, or notification before you get to campus, as you get to campus, as you enter a building, that masking is required. So those are there. I'll tackle the next question that Laura asked, which was, have we hired additional M&O staff specifically for cleaning bathrooms, replacing hand sanitizers, and masks? So the answer to your first question is M&O is under the same hiring freeze as everyone else in the district. We haven't been able to hire additional staff, and due to some retirements and promotions, we haven't been able to replace those staff members either. But I can assure you that we established a practice at the very beginning last March, and we've held to that practice that we shifted some people's work schedules, and we shifted them so that every hour we have someone in every building and in every restroom that's either checking supplies. So they're in every building to check the supplies, to check to make sure there's hand sanitizer, but they're also going into the bathrooms and cleaning those high-touch surfaces. Now, you heard earlier from Jill and from Madeline that it's not necessarily as transmissible from a high-touch surface, from a surface to your, as it is an aerosol, virus particles. So, but we're still following that practice, and I think it's a good practice that we will continue because it shows that we care about the spaces that you are inhabiting. And so I'm promoting that, and I'm saying to my staff, let's continue that practice as we move forward. So, and I know Laura had one other question about ventilation in 700 in the upstairs. So yes, we have gone through every building. We spent fall semester when we realized we weren't coming back. We spent fall semester verifying that all the building HVAC systems were working with our existing staff, and made sure that they were working and working efficiently and that they were working properly. So if we have a breakdown, we know it's not. It was just that, a breakdown in the system, and we'll be back to fix it as quickly as we can. But we know they're working properly. And then, as I mentioned earlier, we'll be changing the filters regularly.
Owen, sorry to interrupt. My question is specifically that my understanding is that CARES money could be used for the hiring of extra M&O. Is that correct? And about the bathroom in the 700 building, specifically the one that faculty uses in the 700, some students and the staff, of course, around that area, sometimes that ventilator doesn't work, the exhaust. We just turn it on and turn it off and it doesn't work. So I'm specifically asking about that bathroom. Thanks.
Yeah, so I'll check into, I'm making a note about the 700 staff restroom, that the exhaust fan, we make sure it gets modified to be on 100% of the time. And yes, I understand the CARES Act, the way the CARES Act is written allows that, but understand our collective bargaining units have potential, and I cannot subcontract out work that is currently done by a bargaining unit member. So I can't go out and hire someone to do that work. So we are working with what we have, and I assure you that we've got people who are coming into your building and have been in your building every day, going through those buildings every hour. And we'll continue that practice as more people come back, but I'll make sure we get address the exhaust issue that you raised. Thank you, Laura. The next question in the chat from Shannon was on 3 to 4 foot distancing. So know that we, as a district, we're going to, as much as we can, we're going to adhere to the 6 foot separation distancing. Where that 6 foot separation has a potential to be closer than 6 feet is in the classrooms, and that's in accordance with the guidance for institutes of higher education, which says not distance, but percentage of students in the room. So we know 50% to get to a 50% number for students in a classroom, the space between a student would have to be reduced to approximately 4 feet to get to that 50% number. Because the 6-foot social distancing capacity in most of our lecture spaces, and this is kind of lecture specific, but lecture spaces requires us to be less than 6 feet. In our lab spaces, we can often be at 50% capacity with 6-foot distancing. Depends on the type of lab. In automotive, we can be at 100% capacity with 6-foot social distancing because the space allocation per student is different in each of those different types of labs, as you might know. So we think that reduction will be specific to the classrooms and not necessarily to other areas. We'll likely keep classroom, conference rooms, staff work areas, staff common areas at that 6-foot distancing level. So Debbie mentioned we're in the last, I think we're now in the last 18 minutes of our presentation, so I'm keeping an eye on that as well. Next question was about levels of protection that wearing a mask provides. In addition, I'm wondering about those of us with respiratory issues that wearing a mask for several hours is challenging, and what is the recommendation? So for that one, I'm going to turn to probably Jill on this one.
So I think the easiest really good mask to wear is just a simple paper surgical mask with the tie and tuck, because it's a fairly thin, breathable option. If you end up having specific problems that you're seeing a pulmonologist, a lung doctor, anything like that, that would exclude you from mask wearing in a meaningful way, then that would be something that would be handled through human resources. But I would definitely encourage you to look at different options, try different options at home. You know, even if you're going to be using the surgical masks that are sourced by the school, like look for your own most comfortable fit solutions. When we started opening the kindergarten and the nursery school, those kids, you know, we asked them to try 5 or 6 different versions and try them on at home and wear them and see which one your kid messes with less and which one makes them happy to be wearing their mask and not ripping it off their face. And so it's really a personal fit to find your favorite mask solution. And then if it becomes something that is truly like a medical contraindication, then working with your HR department and your physicians.
Yeah, and know that our HR department is prepared for individual accommodations if necessary. And so, you know, we are working towards that. I think the next question came from Katie. What recommendations do you have for maintaining distancing in our counseling offices when we are typically sitting at close range with a student at our desk? So again, that 10 by 10 office, a desk, and a student immediately across from them in the desk that might not be that full 6 foot. So Jill?
So when we were working with the middle school, we were working with 5-foot desk spaces. And how do you put kids 6 feet apart from each other when your desk is 5 feet long? And you can actually find that within a given room and within a given set of furniture that you have, you can use the furniture to kind of make that space for you. So your desk might be 3 foot across this way, but it might be 5 feet across that way. So you might end up having you sitting kind of kitty corner to them in a different way. So instead of right across that desk, you're diagonally across the desk with a way to be able to share a monitor by turning it and angling it. So each person can explore their workspace to kind of optimize that. And Madeline is excellent as well with her team at going through workspaces to be able to take the parameters of an enclosed room, take the furniture that's involved, and optimize your spacing and positioning with regards to the other people that might share that space.
So I did, I made sure that I went up and looked at all of those spaces recently in Building 700, and I echo Jill's sentiment. And yes, furniture arrangement has become a new skill set of mine. But another thing to think about, and I'm sorry, you might have said this, I was answering another question in the chat, but there's a couple considerations. You know, obviously we want to protect you from exposure, but also if we're assuming two unvaccinated people, if one of those people is, you know, tests positive or becomes symptomatic, if you've been closer than 6 feet for more than 15 minutes cumulative over a 24-hour period with that individual, you would then have to quarantine. There are exclusions for that for vaccinated people, as we talked about, with the exception of someone who's, you know, if you're showing symptoms, it doesn't matter if you've been vaccinated, you'll still need to get tested. But so that's something to think about in those spaces. So then it becomes a little bit of like a personal choice. Is the intent of your workplace to make it so no one has to, quarantine if there's a potential contact, which means to take away any and all possibilities for contact? In those 10 by 10 offices, someone sitting, on the other side of the desk, several feet away from the desk is 2.5, 3 feet wide, and then another, whoever's sitting behind the desk is several feet back from the edge of that desk. Now you have 6 feet of spacing, and now you're just looking at the amount of time you're in contact. From an exposure perspective, you're managing it in that space because of face covering, universal masking. You're managing it through the ventilation and filtration in that space, and you're managing it through, now you've been able to create some distance. However, we know that there are situations in which you need to, maybe it's sensitive and you want to shut the door, right? And actually shutting the door in some cases increases the number of air changes per hour in your space. But, and this kind of goes into Shannon's most recent question here, for some of these spaces where you want to be able to be in an enclosed space for a prolonged period of time, and if there is not adequate supply and return air exchange in those spaces, a room air, HEPA room air purifier would be something that we would consider putting in those spaces. Like Owen said, in Building 700, there's a lot of, there's good mechanical ventilation in all of those rooms, so that would be something that we would consider on a individual basis. I've provided him with specific guidance on how to select appropriate room air purifiers, and that information he can share with you and share with supervisors. I think that kind of covers what's happening in those spaces. I do want to make sure we get to, I think it's pronounced Katrin, your question.
So Katrin's had her hand up for a few minutes, and then we'll jump back to the questions that are in the chat. So Katrin?
Yeah, thank you. I just have an additional question for the bathrooms. So Owen, when you said we have arranged, or we have a different schedule for our M&O folks, now that of course was also while we were not on campus. So now we are on campus, which makes, their work a little more lengthy. I would imagine going into a building that nobody's in there, or maybe 2 people a day, versus going into a building where now it's like 3/4 of the people in there. So that's my first question. Is that going to be considered that they need more time for the buildings to clean them because now there is more, there are no more people in it? And then my next question is, especially for Building 700, and I don't know if you're familiar with the bathroom situations there, but at the bottom floor of Building 700, there is one staff bathroom, and that's a multi, so it's just one toilet that anybody can use, right? And the rest, there is, then there's an open public bathroom for all the students, and then there is the second staff bathroom was converted into a multi-gender bathroom. So my question is, when I come in the morning, from my experience, within a couple of hours, you can no longer go to the public bathroom. It's just a total mess. And apparently that is before we changed, because I don't know how often they came during the day, but these bathrooms became badly, very quickly. So is there anything in the works that we have people come in to clean the bathrooms more frequently now where we are returning to campus, especially since we don't have more than one toilet, a dedicated bathroom for staff, and I don't know how many people are on the down floor, but there's quite a few. So, and now I heard what kind of makes me also a little bit of anxious is that I heard that, you know, people are taking off their masks in the bathroom because they feel like that's a safe place to do so. So that's probably the dirtiest and most infectious place in the building now. So yeah, what are the future plans when we are returning to campus? Because I feel like there is more work for the M&O folks.
Yeah, thank you for the question. Yes, so the answer is we will continue on our enhanced schedule to be in all of those spaces. We're not going to relax on that component. Yes, we think it will take a bit more time when, and some of that has to do with there's occupants in the room or not occupants in the room when they get there, and they'll have to wait for someone to vacate the room to go in and perform cleaning. But we think we've worked out the schedule. We know it's working in areas where we've had classes going on, and so we'll continue that process as we bring more and more people come back to the work environment. But thank you for the question. So yeah, and again, part of the training is to remind people not to take your mask off when you're in the restroom, right? And to continue to wear it there. So hopefully that will decrease the amount of exposures that we have in those areas. But you're right, it's a personal area, and everyone might feel safer either in a stall or in an individual single occupancy restroom. So, okay, thanks for the question. We'll jump back to those questions that are in the chat. Admin question: who will be assigned to monitor the lobby, particularly in 700 building, I believe? Almost all stores, there's a person at the front sort of monitoring and letting know, wait outside and when the line is too long. So Vice President Critcher has engaged student ambassadors. One is scheduling appointments. I believe he's looked into or investigating a scheduling app so that if a student was coming in for an appointment, they would get a text notification or a notification through the app. But he's also instituted the student ambassador wellness table outside of in several areas on campus outside of buildings. I believe outside of 700 is one of those. So there's a table. It'll have masks. It'll have hand sanitizer. It'll have cleaning products, and also have the information sheet with someone who's there, who will be kind of an ambassador to remind people, please put on a mask, hand them a mask if they didn't bring one. So right now, at least Chabot College, and particularly in the student services section under VP Critcher, is that has been kind of specifically towards that student ambassadors handling that point. There was another question about anyone who refuses to wear a mask. Fortunately, we haven't had this issue anywhere on campus yet. We may have that. I've been reported as not having my mask on, and I take it as a gentle reminder, no matter how it was said to me, that I needed to put my mask back on while on campus. Particularly happened early on in the pandemic, and we were all wearing masks, even outdoors. For a period of time, Alameda County said anyone within 30 feet of anyone else had to have a mask on in Alameda County. And so now they've relaxed that down to 6 feet outdoors. I think still having your mask on shows respect for our kind of new social contract with everyone. So, but campus safety is not necessarily our first response. It's the gentle reminder that, hey, we require masks here. Can you please put a mask on? Comment from any of our staff members or student ambassadors who might be working on campus. So, Sadie, thanks.
I just want to jump in really quick. I'm sorry to cut off your last word there, but I know that Jill has a hard stop at 3:00. So I did say in the chat, I can stay on a little bit longer if people have questions. And then anything that they have for Jill that we don't get to, I can send to her afterwards.
Okay. Did you see any questions in the chat that were specific to questions Jill should answer?
I think there was just a question about eating, and yes, take your food and drink outside. Find 6 feet away from people and enjoy the glorious days of sunshine. And if you want to take meetings outdoors too, if they're not sensitive, if you don't need a computer, taking people for a walk meeting that you're around, you can use your outdoor space creatively as well. At the hospital, our break room became not a break room, but we did keep a refrigerator and a microwave there where people could heat up their food and then take it outside and use the microwave to store their snack. Use the refrigerator to store their snacks, but it didn't become a hangout space. It wasn't a place where people could eat publicly together, because again, that's one of your highest risk. You think you're taking a break, it's just the people that's when masks come off, and that's a higher risk situation. But it's fine to use those break spaces to store your food, then prepare it and take it outside and enjoy it in the fresh air. And you guys are wonderful. Get your vaccines, get your friends vaccinated, get your family vaccinated. We'll try to get all of the students vaccinated. The rates are going to be low, and the risk is going to be low, and you can continue to do your amazing, amazing work of letting people find opportunities in this world. It's been a long, hard year, and working from home has been difficult. The lack of connection, the fear is real, and it takes a little while to get out of those patterns. We took so long to get settled in them. Give yourself patience, forgive yourself. It is a process, and it sounds like you're a tight team and you can get through it together. And wishing you a fabulous, fabulous year ahead.
Thank you, Jill.
Thank you, Jill. I just noticed in the chat there was a question about portable air purifiers, and so there's a couple different sizes and styles. I've been doing some research with our purchasing department to see if we can source some. And again, this is part of CARES Act money and making an environment that you would feel comfortable coming back in. And so we'll work on that air purifier and getting some on order so that we can distribute them around to those of you who feel it would be a benefit to your space. I want to make you feel comfortable coming back, and that's one of those pieces. So, and as Madeline said, she's provided me a list. Note that the federal list and the California list are different lists, right? Because some, in particular, if you're rushing out to buy one, I'll give you a hint. If it says it's an electronic air purifier, don't buy one of those, because they're not allowed to be sold in California because they generate ozone, because they typically have a UV light in it, which generates ozone when it hits a particle. They're not supposed to be sold in California, at least according to the Air Resources Board. So know that if it's quote-unquote electronic, those aren't ones we want. What we want are ones that are a true HEPA filter, and know when we buy one, we need to buy replacement filters for them as well, so that we can keep them working as efficiently as you want them to and as we want them to. So it's my little, don't rush out and buy one just because you saw a great deal at the store, right? Or Costco had them on sale, so I bought 4, right? I think we answered the question. Eat outside if possible. I think Jill answered that one.
Sadie had a question about campus security. You see hers? She says, just to clarify concern, if we're to involve campus safety rather, how to how do we support or train campus safety to respond to these sensitive situations? I'm not sure if it's connected, but many colleges are hiring mental health professionals specifically to accompany campus security, I guess, when they're making their rounds.
Yeah, and so I know that our campus safety people at both campus have been participating in trainings and in sensitivity trainings and appropriate response trainings throughout, I believe, the pandemic. And so, I don't know that we have, quote unquote, a mental health professional who's been brought on specifically to address this, but I've captured the chat notes, and I'll make sure that I follow up with them and make sure that they understand the concern, at least from our end.
Debbie had asked about, using the microwave and the fridge and those shared things. And think about that like your copier in your copier room. At the beginning of this, we were really nervous about communal items. In our office, we had like a cleaning log, and every time you touched the copier, you had to wipe it down and sign the log. And I mean, it was very, very tedious. As long as you're practicing good hand hygiene throughout the day, keep some hand sanitizer in that kitchen. I prefer to wash my hands before I eat rather than use hand sanitizer because it smells weird, but there's no reason to discontinue use of those things. Just be mindful that it is a shared surface. And I mean, really, like, just like anything else, you want to be thinking about the fact that other people are touching it, and you don't necessarily know how good people are about washing their hands in the bathroom and things like that, like we were talking about earlier. So those can stay. And then, yes, you can eat in your personal office with the door closed, of course, but just, be mindful of the fact that, now you're in there, you've been talking, and, some people may not be comfortable. It may end up turning into sort of an equity issue if it's raining outside, so just these are things that have started to come up over time, and really that's kind of on you, Debbie. It's like managing a lot of this stuff, but they're just things to be mindful about. And they're, whether or not you've been vaccinated doesn't change the fact that you need to be wearing your face covering when you're around other people. So if you're comfortable not wearing your mask in your office and then you walk out to go use the restroom and someone sees you, they're probably going to say something. And like Owen said, very graciously takes it as a gentle correction. We're all in this together. And I think the response of, I'm vaccinated, it's okay, that is not necessarily going to fly, right? So we need to be mindful that the recommendations do say, even if you've been vaccinated, when you're out in public, I'm fully vaccinated when I go out in public, I always wear my face covering. I'm excited for the time when that doesn't happen, although I think it's going to feel super weird. But because some of my colleagues and I, we're all vaccinated now, and we're still like, I don't know, I'm going to keep it on. This feels crazy.
Yeah, and I will say there's a benefit to taking that break outside, and it's a mental health benefit, right? I will tell you, because I've been in the office almost every day, that my answer to you is going outside is really good for your mental health. I encourage you to do it, because having been there every day, and on some days I'm like, I'm just going to eat in my office because it's raining outside. I leave the end of the day, I'm either exhausted or I don't feel good. So I'm saying I encourage everyone to go outside during your break, go outside during your lunch, because it just makes you feel better. So even if it was raining out. So, Debbie, I know you're working on kind of a plan and how that works out for all of your employees. Is kind of the next step. We want to make sure we've got you guys trained so you know what the expectations are in there. But it's really, from the chancellor, my office down, everyone's saying we want to provide the flexibility to the supervisors to make sure you operate your spaces and open your spaces as safely and as efficiently as you can. So any last questions? I haven't seen any more pop up in the chat. I didn't know if there's anything else. So otherwise, I'll turn it back over to Debbie for the rest of her meeting, which we probably ran long on.
Oh, yeah, it's gone. Are there any other questions and comments? I'm going to be emailing you guys because I know that there's some contractual things that are going on too. I want to be sensitive to that. Is there anything else?
have a question, and this might not, I know it might not be COVID-19 related specifically, but now that we have you here, Owen, I was just wondering if I could ask.
Absolutely.
You know, in 700 upstairs in general counseling, we have we have carpets, you know, and I'm just wondering how often are we going to be cleaning those carpets? Okay, those carpets at times, you know, it's a whole semester, and those carpets are not cleaned, you know, with that often. Secondly, I just, perhaps you already know this, Owen, but you know, there's some filtration, and I have a picture. I'll be happy to share my screen. On the 700 at the end of the hall towards our break room, there's some filtration up there, and I'm concerned if, you know, that might impact any kind of airflow or not. That's not a question that needs to be answered right now. And lastly, you know, we have a kind of an exit again, and you know, in that long hallway, and we sometimes have to go out of our office just to there's a bin there for when we want to get rid of documents that are that need to be shredded. And I was just wondering if we could actually put shredders in our specific offices so we can minimize the back and forth outside our offices. And I don't think that there are two bins, and I don't think that the other one might be needed anymore because we are minimizing the paperwork. But there is also, you know, like a lamp. There's some stuff there that shouldn't be there, right? For an exit. And I was wondering if that could be, you know, thrown away. And there's also a file cabinet there that, you know, doesn't need to be there anymore. So, and then lastly, you know, you talked about, or it was mentioned in this call, that when possible, we should, you know, keep doors open. And that's the only door that we have in the 700 building. And I was just wondering, how can we actually keep it open, you know, because it's a door that closes. So, yeah, so just wondering. And again, thank you for being here today.
Sure. So to answer your carpet cleaning question, our biggest challenge has been cleaning carpets. For cleaning carpets is having enough hours to clean the carpet and allow it to dry in your office space. I can tell you, I believe we've cleaned every carpet, every floor, deep cleaned everything, because the custodians on both campuses were declared essential services workers, and they literally haven't been on campus 2 days throughout the whole pandemic. We brought them back immediately. They continued to work throughout the process, and they've been the ones that have been on campus every day. So I believe we've cleaned everything. The challenge is finding that break in the schedule where we have enough time to do a deep cleaning of spaces and staffing to do it with. But I think we're there now. Filtration in the break room, I will look at that when I'm on campus. I also review the HVAC system again, because I know there's a couple other questions that popped up that I'll go dig into our original drawings and make sure I know what it is, and so I can give you a better answer. And then personal shredders versus using the Iron Mountain or the shredded bins that are outside. I don't see an issue with personal shredding. I know in some cases it doesn't shred as finely, or as, you know, the super double crosscut, whatever shredding that it was. You know, it's you know, just the disposal of the shredded documents is creates a little more air in the waste stream. But if you guys have a need and desire to have personal shredding, go right ahead. I don't see an issue from my standpoint. And I'm scheduled to meet with Debbie, I think, on Monday, and I'll walk through the space with her and take a look at all of those areas. And, you know, if there's items that can be moved, if there's items that are empty and we can move them out of the space for you, you no longer need them there, we'll certainly tag them, and then I'll get the custodial staff to come over, pick them up, and move them off. You know, hopefully before all of you are back for extended periods of time. So.
Anything else?
questions?
Okay, if not, I will be sending a follow-up email to all of you all. Thank you so much, Owen, Dr. Jill, Madeline, thank you so much. I'm sure we may have some additional questions, but I have you on speed dial. And so I'll make sure that I, get that to you, and I'm just, be working out. We will be doing this plan together, you all. What I'm going to send you after I have another conversation is just, I just wanted to get the ball rolling. So you will all be a part of that process as soon as possible. Not next week, you guys will be gone. So actually, while you're gone, don't think about work. When you come back, then we'll kind of start to figure it out. So thank you, everybody. Appreciate you. Guys, have a great spring break and get some rest.
Thank you.
Thank you, everyone. Thank you, Debbie.
Thank you.
Thank you, Owen.